Saturday workshop, we are demonstrating supine PCNL for a left side pelvic stone with a lot of fat. He is 110 kg. See, when you see this fat, you should not be worried. When you see this fat, you should not be worried because you are not going to puncture any of these areas. You are not going to puncture. So don't see that. Be focused like Arjuna. It may be difficult because long length between them. So primary thing is, can you feel the iliac crest here or not? These are the problems. So unless you do this, you cannot feel. This is the highest point of the iliac crest here. Unless you do this, like this is called strapping. You cannot feel. This is the I am feeling. Clearly I am feeling here. Okay? This is the first step to have idea. Now somebody pull this like this. Pull. Jorse. Somebody pull. Then I got a flat surface here. That is the most important for your puncture. Then I am trying to feel the rib. It is difficult naturally. See, he is nicely. Here it is rib is coming. Now this strapping is essential to have this direction. This area fat when compared to this panus is less. So unnecessarily you need not worry. Now positioning, what I say, this is the anterior axial line, this is the posterior axial line, this is the mid axial line. Whenever you keep that, this is the posterior axial line, roughly. This is the rib position. Anywhere below this area, you have to puncture. This area. For that, what you do, whatever he is doing strapping, plus little bit patient has to go down first. So go down first. See, go down itself, go back and record so that you can see. Go down. See, go down, how many people are required? 3-4 people are required. So you are going down. Still down. That is very important. And now what he says is, but still some more? Yeah, yes, okay. Yeah, because Siam also will have problem. First this hand should go that side. And this person will pull that side. Take that side. Pull, lift. See, that is not very difficult for this personality. He is not heavy personality. Only thing is that patient should not fall that side. That's all. Oh, that's our position. Ipsilateral side below. That side, the only problem is if you keep it straight, you can do better surgery. Okay? So for that, what you have to do, there is a disadvantage. If you put like this, then you can do better surgery. See, this area you will enter. Again, I will feel this is the rib. So anywhere here I will enter, I will go horizontally. So this area enough. The moment you turn this, see, this is coming side. Your area is reducing. The moment you go like this is stretching. Now immediately what has to be done? Somebody has to do this. Give the gynoplast and pad. This is most important. This stretch. If you stretch like this, see how. If you see only this area, do you feel that obese? Why you will see this? Why you will see this? All those things you don't see. You just stretch this. Feel the rib properly. This is the rib. You can feel the rib in difficult situations also. Stay back below the rib like here. No, not like that. He is saying gynoplast. I need a sponge. Over the sponge, I have to pull and then push. Because that spinal in between, your spinal cavity, some damage will occur. That you will not realize now. When you reach 60, you will realize. Hey, any bus cut karo? In this direction. Next, in this direction. Yeah, go there. That's all. Now, this area will not puncture. So now what we do is, what I personally feel is you put it. 100% you can puncture in this region. There is no doubt about it. If you go, some colleagues will. This spinal region does not have that much amount of the fat which you imagine. You know, there are certain areas where fat is not deposited. Can you tell? Penis. No fat deposition. Otherwise, huge organ might have been there. Second thing is center of the spine will not be there. It is brain. Then the nipples and you inject the contrast. Carefully see the contrast. It becomes a very nice. See now, 1 millimeter I have gone down. See the movement is more now. See, that's all. And now you remove it. I can't come cut done.
This is a real there to show crystal clear urine. Why it will obesity, all those things. No need to worry. So it was needle was going down. That means I have to come out and go little posterior. That's also down. That is also good.